The country gears for lockdown level 3. More people will be using public transport as more sectors open up and people return to their jobs now. Is our public transport system ready for the numbers that will be commuting? Will Metro Rail be able to ensure commuters adhere to social distancing on the trains? For more on this, I'm joined now by transport specialist Ofentse Mokwena. Ofentse, good evening and thank you for your time. First and foremost, one would say this COVID-19 pandemic has, to an extent, revealed to the nation, or highlighted at least, how crucial the minibus taxi industry is.
Yes, the minibus taxi industry is quite important, and it's also quite obvious that people don't necessarily have alternative transportation modes. But in addition to that, the importance of non-motorized transport is also highlighted in the current circumstances as well.
Now, since the lockdown, they were declared an essential service, however, but on a limited scale in terms of the time that they're allowed to operate. Has it made any difference at all to their bottom line? And what patterns are we seeing in terms of activity, financially, that is, of the taxi industry?
Well, because of the nature of the industry itself, it's extremely difficult for an average operator to make the appropriate margins with such a low fill rate. So if you're operating with 70% of your passenger boarding from the taxi rank, you also create a situation where along the journey where you usually pick up passengers as some get off, some passengers have to wait longer than usually to make specific journeys. And it's quite a challenging environment for both the operators and the commuters as well. And in terms of their bottom line, the only data or information that is available tends to come from the finance houses that are associated with providing capital for vehicle purchases. But what we know is that there are some reports that the operations are much fewer, so there's a significant degree of fewer trips that are being made in general by a single vehicle.
Are buses more geared, would you say, to adhere to the protocols and still be able to operate optimally, considering that buses have a set route and probably a set time in the way that they move?
Yes, well, in assuming that we have passenger volumes that are lower than what is usually expected, then you might find that buses could operate, but the nature of these viruses is that, ventilation, social distancing, and the practices, the code of conduct in the public transport vehicles is going to be crucial. And the bus operators will be responsible for the implementation and monitoring, but at the same time, the financial guarantee comes from a subsidy. And this might inflate the subsidy bill for the bus operations, if not contract the money that they'll actually ask for.
So we've seen, of course, somewhat an extended period for taxis to operate 5 a.m. until 7 p.m. with that extended hour to round up the trips. Has this affected the commuters' mobility in any way? Yeah,
let me put it this way. So on average, South African commuters tend to use non-motorized transport and minibus taxis, and last but not least, buses. And the manner in which we're trying to mitigate the virus and the layers of the levels that are being implemented tend to change the way in which people decide on making their trips. So those households that can afford, for instance, to procure ride-hailing services tend to do that more often than not. Some individuals are choosing to use non-motorized transport for the entire journey just to avoid the likelihood of being infected. The limits to our understanding of what's happening come from the fact that we're not collecting sufficient data on a national level. So our National Household Travel Survey, we should actually be having a COVID-19 survey that is trying to explore the dynamics of what we're doing at the moment.
Now, these, of course, are measures that are going to be with us at least for the next 18 months or so. This is going to be the new normal. This is going to be a way in which we operate businesses, we operate transport, we operate in terms of gatherings, in terms of what happens in our learning spaces as well. Are taxis, in terms of their model, their operating model, geared for this? Will it cost them more, for example? Somebody was asking that. Will this thing of giving sanitizers a litre, maybe per trip, not hit on their bottom line? And therefore, are they not going to be passing this on to consumers? And at the end of the day, we will see transport fares going up.
So here's the big challenge, right? The big challenge comes from deciding between providing an operator-based or a user-based long-term relief system, especially for transportation. This is the trade-off that the public sector actually has to make. So in the short run, it might work to provide relief for the operators, but in the long run, it might make more sense to provide financial support for commuters who choose whatever transportation modes they want to use. And those are the kind of dynamics that apply to the taxi industry. The next layer is, what is the role of the associations? What is the role of the transport authorities in coordinating these efforts? And that is where the transport authorities become crucial. And playing this role to coordinate enforcement, hygiene, and also long-term coordination going to be quite crucial, especially for municipalities.
Let's talk about long distance for a bit and how that has been affected. I mean, now non-motorized travel could be an option if you're traveling a short distance. Yeah. When you've got to do long distances for maybe bereavement and so forth, how is that fared during this lockdown?
Well, I think the most difficult part for long distance commuters is the fact that the trips are actually quite limited. So the service availability is limited because of the constraints on interprovincial mobility. So long distance, if we're talking about interprovincial markets, we are extremely constrained. And the companies that provide these long distance transport services and also the operators, taxi operators, bus operators that provide unscheduled services are going to be exposed to significant financial risk. And this risk is going to be felt by the social environment. So, your ability to go to a funeral or your ability to just do your weekly or monthly journey home. And on the other hand, it's going to have an economic impact, which will affect the bottom lines of these operators. Remember that for some companies, 2 months are equivalent to a significant portion of your profit for the year, if not a few weeks of the year, are equivalent to your profit for the year. So now with limited operations, lower costs, of course, because nothing's happening, there is a chance that some companies might not make do, especially given that they still have to keep employees safe, secure, and employed.
What are the chances of containment when we move down to level 3? Is the question everybody is asking. With all the layers that they might bring in with sanitizer booths, gloves, fumigating or disinfecting the taxis twice a day. Moving down to level 3, what are we likely to see?
So one dimension is that we could have the practices or some of the practices that are happening now becoming the norm. So hygiene in transport interchanges, ranks, and other facilities might become the norm. But then internally, in terms of the vehicles themselves, the challenge is that the virus is airborne, and mitigating it through public transportation interventions, it's all about reducing the probability of infection. It is not a prevention. It is only an effort to reduce the probability. That is my understanding of the efforts that are on the table. However, if we're going to do this right, we might have to take even more significant steps in scenarios where people are traveling over longer distances and longer periods of time. Because the exposure rate, if one person is infected and doesn't have any symptoms, might be higher than what we expect.
Ofentse, I appreciate your time. Thanks for joining us tonight.